Now we're moving on to another category of drugs, used in the treatment of asthma, and this category of drugs are known as a mediator antagonist. Mediator antagonist. Okay, so for these drugs, what are examples of drugs that actually fall under this classification, and what are their roles, okay, in the treatment of asthma? Okay, so let's quickly look at the category of drugs that are known as the mediator antagonist. Okay, so mediator antagonists, just so you know, they are drugs used in asthma, and basically they block the actions of what? Inflammatory mediators. Do you understand? You know, there are some inflammatory stuffs that are usually released into the system in asthma, and they promote inflammation. So things like all those leukotrienes, have the histamines, you have the prostaglandins, they drive inflammation. So the mediator antagonists now, they are the ones that will now antagonize. So antagonize is like I'm against somebody. So role of mediator antagonist is basically they block these bioactive mediators. Okay, so things like the histamines, things like the leukotrienes, things like the prostaglandins, things like the thromboxanes, things like the platelet activating factor. So blocking those mediators will reduce all those symptoms that usually come up with asthma. Do you understand? So types of the mediator antagonists, we have the leukotriene receptor antagonists, so drugs like the Montelukast. Okay, then we have the Zafirlukast. We have the 5-lipoxygenase inhibitors, so drugs like the Zileuteine. This is Zileuteine. We have the antihistamines, so drugs like the cetirizine, the loratadine. So this is cetirizine. Alright. Then we have prostaglandin antagonist. Okay, so those ones are mainly still in the lab. They are still experimenting on those ones. Alright. So clinical applications is they are useful in children and patients with poor inhalation technique. You know, so effective in exercise-induced bronchospasms, aspirin exacerbated respiratory disease. So Zileuteine reduces leukotriene production. So basically antihistamines, those ones will now reduce, you know, all those allergic stuff that are usually released in the system when there's asthma.